Hey everybody, welcome to the TIMGA podcast. And today I'm joined with Paige Korbakis, Director of Design Solutions Design and Delivery at Jobs for the Future, also known as JFF. Paige, welcome to the show.
Thank you so much, Mohamed. Happy to be here.
And so Paige, I think we've met. When did we meet? Was it 2024, 2023?
2023, I believe, at the onset of the Rural Immigrant Success Exchange Network. But I had been familiar with TIMGA and previously Washington Academy for IMGs before then.
Yes, and like you have a lot of experience working with immigrant professionals, not only IMGs, but with all kind of immigrant professionals, and with your time at Upwardly Global. Can you just kind of talk a little bit about how you got into the space?
Sure. I've been working with immigrant refugee populations both in the direct service capacity as well as an intermediary currently at JFF for the last 12 years. I got into it right out of college and I was essentially a job coach supporting immigrants, refugees, asylum seekers who were professionals in their home country who had skills and credentials from abroad who, when they came to the US, needed some support in job coaching, workforce training, and rebuilding their career here in the States. So I worked really closely one-on-one with folks primarily in the tech space or tech adjacent occupations and help them build their network, expand their social capital, help them with resumes and cover letters and connect them with employers. So did that for about 6 or 7 years at Upwardly Global, and then as a program director there, and now as a director at Jobs for the Future, working with other immigrant serving organizations to help them and support their participants as well.
Paige, how was that experience like? Because I know I speak with a lot of IMGs like looking for jobs, entry level jobs, like when they come to the U.S. Because they have to prepare their USMLE exams, and that takes a while. So they need some kind of living to support their family, and it's not easy starting from scratch and kind of presenting your resume. So how's that experience like working with people to shift their focus to fit the American job market?
Yeah, I mean, it's hard. It can be a long process for some people. Some folks come to the US by choice, others are fleeing war or persecution. Some see this opportunity of being in the States as a chance to start over and build a totally new career and have a pivot. So we'd help them reskill or get an additional credential or certification if they want to switch from, engineering to business analyst, for example. Others just want to continue rebuilding what they were trained to do and had worked in many cases for decades. Specifically for IMGs, as you know, the process to relicense is long, it's complicated, it's expensive, it's very confusing, it differs state to state. And so what we tried to do is that we had a coach who specifically worked with all of our medical professionals. So that would be both, physicians, nurses, medical assistants, pharmacists, anyone in the healthcare profession, help them relicense. And what we tried to do, to your point regarding entry level positions, is knowing it could take oftentimes a few years for them to get re-credentialed and relicensed and obtain that certification, is get them some exposure to a healthcare setting in the US. So
Yeah.
may be somewhat of, they may consider it being a step down. So they may work as, a medical interpreter or a medical assistant, but it is an opportunity for them to, practice their language in a professional setting, give them, some stable income to pay rent, pay the bills, pay groceries, while they embark on a much longer term plan to rebuild their resume. So it's a chance for them to get acclimated to the US healthcare system, practice their English, start to build their network, and start to make those professional connections concurrently with the relicensing process. So for some, that's actually what they prefer. It's more of a, gradual baby steps. And others, it's really hard. They want to, work as a doctor if they worked as a doctor. So it kind of depends on, case by case basis, but that's typically how folks we tried to help set up for success, and also connecting them with other healthcare professionals as mentors, with volunteers, even with other healthcare professionals from their own home countries.
Yeah. I, mean, I think that's for me because I've done that before, right? I've worked with one on one with people, and the challenging thing is a lot of people, come back to me and they say, "Hey, so I applied to this job. Everybody's saying you're overqualified. How
Yeah.
can I change my resume? How can I like, what can I change?" Have you ever came up these scenarios like where people employers kind of see these doctors as overqualified for these roles?
Yeah, I mean, many times they are overqualified for what they
Yeah.
are applying for, and they may have more years of experience than the person interviewing them.
Yeah.
So that is a very real scenario, and I think for like similarly to any job interview, regardless of occupation, it's all about the messaging and the framing. So they'd work closely with their job coach, who again specializes in healthcare, and she would work with those individuals to craft a response that is, honest and compelling, but that explains why that position would be appropriate for them at this time for, supporting their family, for, going through the relicensing process. And, you can still acknowledge it, but having a compelling reason for why they're interested in that job and why that is a natural next step for them here in the States, usually helps to kind of disseminate that concern.
Yeah. And I know like you're familiar with how difficult the journey is for IMGs, and it's not only because you work with IMGs, because a lot of people don't know this. Like, it's quite personal for you too, because your grandfather was an IMG. Is that correct?
Yes, yes. My grandfather on my mother's side was a refugee. He had to actually relicense twice, once from Poland to Austria and Austria to New York. So he was an IMG himself. He was a family physician. He was an internist. He actually ended up founding a hospital in the greater Chicagoland area. So, yes, very personal to me. He was incredibly proud of his profession. Being a doctor was a very integral and central part of his identity. And I think when he came to the US, I think he made $11 a month, and in the 40s, and seven of those dollars went to pressing his and dry cleaning his doctor's uniform every month. So they came here with nothing, and he was able to build a super successful career over many decades. He worked well into his 70s, and yes, it's very personal for me. He always talked about having to redo his exams in multiple languages over many years while building a young family. So certainly, yes, is personal and professional for me.
Yeah. Well, that's amazing story, and he would definitely be proud of the work that you're doing today. How did you feel when you heard about these alternative licensing pathways that are around the states and like that are coming in different states? Like first, I know we first worked together very closely in JFF, but like before that, like when you were hearing it, like how did you feel about it, and like what was your thoughts?
I mean, I think my thought was it's about time.
Yeah.
We have such an incredible talent pool here in the US with healthcare professionals from all over the world who are incredibly talented, who want to work, who are authorized. And we have a healthcare shortage, especially in underserved and rural communities. And there was just a very, natural connection point that we were making it too hard for folks to be able to work. And, we saw some adjustments being made and some, streamlining of policies and processes during COVID for healthcare professionals. And I think, this has been a long time coming. There's been policymakers and champions like yourself, other community-based organizations and healthcare organizations who have, been advocating this for many, many, many years. And I think the more we can, lessen the barrier to entry for these folks to be able to work and use their skills and their competencies to be able to support our healthcare system. I mean, I think that's a win-win for everyone. And I think that's something really everyone can get on board with. So I'm really proud of you and for the state of Washington, which is certainly a national model. And I hope other states, which I know they already are trying to adopt that Senate bill to be able to customize it for individual states for their own needs. But I really hope this will be a snowball effect and help other IMGs and healthcare professionals be able to relicense in a more efficient and effective way.
Yeah, and I think it's the adoption is just incredible. A couple years ago, like if you even thought about alternative licensing pathway, it would be like everybody would be like, hey, I don't think that's ever possible. But it just shows like like the importance of IMGs, the resilience, and even like in other states, like in your home state, Paige, in Illinois, it's growing. It's growing really great. So I think a lot of people are making progress.
Yeah, it's certainly a conversation. And I think, naturally there should be an evolution as we learn more, as the workforce is starting to, change. And it's just such a dynamic external environment right now. But if there's, again, a way for folks to be able to relicense that is, still holds them accountable to, medical standards and still is, able to practice medicine in a safe and effective way, then this should definitely be adopted, nationwide.
Yeah, I mean, it kind of like, and the reason I was very confused about the way the system was, and how like inefficient it was, and the brain waste was because if you look at different countries, like in Europe, for example, the UK, there's always a pathway. Like there's not it's not an easy pathway, but there's I would say reasonable, right? Yeah, and there's access for a pathway for doctors who come from other countries to prove themselves first, like prove their credentials, pass their exams, and then basically there's also like residencies in those countries as well. But there's something in the middle where like hey, if you get into a residency, that's great.
Yeah.
But if there's not opportunity to do so, you can work as a general practitioner as well.
I mean, you have to have political will. There's got to be buy-in, and there's got to be someone who wants to make this happen. So there's the pragmatic case of it just making sense, and then there's also building partnerships, which you've done so successfully with state and local policymakers to help them really understand the scale of this issue and help them understand the problem, and then being able to actually educate healthcare systems and providers about how to employ and support IMG professionals.
Yep. Yeah, absolutely. And so, Paige, before we get to your visit here in Washington State, and to see like when you saw like MDCs and doctors, IMGs working, I want to start at your current role in at JFF and the RISE program. Can you talk about like what the RISE is, why was it established, and a little bit about the program?
Yeah, of course. Yeah, always happy to chat about RISE. So RISE, which stands for the Rural Immigrant Success Exchange Network, is a multi-year JFF initiative focused on the economic advancement of immigrants, refugees, and migrant workers from rural communities across the country. It was founded or launched in August of 2022 with support from Ascendium and the West Mariam-Assefa Fund. And the network was created to invest in rural serving organizations, building economic advancement pathways, and aim to understand what partnerships, what programmatic elements, and what strategic innovations really spark transformation in advancement pathways for RISE participants. So JFF, we put out an RFP. It was very competitive. We selected 10 organizations from across the country. We had about 101 applications, and those 10 organizations received $150,000 over 2 years to launch or expand promising practices in rural communities. And the network spanned 9 states with varying service delivery models. We had community-based organizations, education and training providers, community colleges. So it was a really diverse network, all with proximate leadership. So it was really designed around the idea that rural communities are not a monolith. Immigrant communities are not a monolith, but these immigrant, refugee, and asylee communities are a major source of talent, of entrepreneurship, and resilience, and a really important and critical part and fabric of the communities they live in. So that is, a very brief, description of the RISE network. But our objectives were really to break down barriers to education, training, and employment for rural immigrant and refugee workers, and also to build, as you know, a peer network and a community of practice. So organizational leaders could learn from one another, share best practices, refine their programmatic models, and strengthen the broader ecosystem. So it was a 2-year project. We ended up extending it for another 16 months. We've served over 700 individuals from across the network, representing 14 countries, and I think only over 20 languages spoken across the program participants. So it's been a really special initiative to be a part of.
Wow. Paige, first of all, I want to say, like, your mind is amazing, because for me, if it was me, I would need to look up that data. I would be, but you're amazing. You remember everything on top of your head, but which is great. It's just like the impact is profound, and I feel so honored representing TIMGA to be a part of the RISE network. Because, like, I remember, Paige, when we were like implementing our program and trying to get employers into hiring our doctors, having that support, that peer mentorship, the peer group to help them basically understand basically how they got into employers, like what tactics they use, and kind of like learning from them. I remember Sarah from Industrial Commons had a great presentation. I will never forget that presentation and what they did, because like it really helped me get to employers in a way that I've never thought possible before.
Well, everyone, thank you for saying that. Thank you for the kind words. Everyone was running different programs, and some folks were focused on entrepreneurship and some pre-apprenticeship, and everyone had different focal points, but a lot of the problems were the same, or a lot of the challenges, I should say, were the same. And there were so many transferable lessons learned across all the communities. So JFF simply, facilitated the conversation, but we really wanted it to be peer-led and peer-driven. All of you are such incredible leaders, and so we wanted to make sure we created, a safe and welcoming space for folks to join and be able to learn from one another. And that's what we did. And I'm sad it's coming to an end this September, but I know the network will still stay connected.
Yeah, and they already are. Like, everybody's connected, texting each other, and I think that will continue as well. So I made some friends. I made a lot of friends from the network. So,
and I definitely want to give, kudos and a shout out to our funders, Ascendium and the Western Area SEFA Fund. They were incredibly collaborative. They gave us the RISE network and JFF. They empowered us to really make, our own decisions in terms of how we invest the RISE funding. They were able to be really flexible with their funding. They listened really closely. They wanted us to really center, community-driven solutions. And that has really proven that can truly expand access to quality jobs, to entrepreneurship, to long-term economic mobility, which really strengthens communities across the country. So they did a wonderful job supporting us.
Yep, that's amazing. Shout out to the funders as always. And quick question, Paige, let's get to your visit, your site visit here with TIMGA, and, seeing IMGs. Tell me, like how was it, like, seeing those doctors and hearing those stories?
So I had the opportunity to visit you 2 months ago, I believe. And time flies. As an intermediary, sometimes it can feel, distanced from the work that we do. And there's, we're kind of sit as middlemen between the beneficiaries or the program participants and the organizations that they serve. So we always really look forward to site visits. It's so nice to be out in the field, on the ground, away from the laptop and the Zoom meetings, and actually see true and meaningful impact. So it was wonderful. We spent a couple days together, went on a little Washington road trip, visited a couple different long-term care facilities with recently placed IMGs, one from, you may have to remind me, Congo, and one from Sudan, I believe. And the second IMG we spoke with, she had been waiting 10 years to practice medicine. And she had been in her role, I think 6 weeks, 5 or 6 weeks. So she was newly in her role, and she was so, her enthusiasm was infectious. She was so excited. She had been practicing on and off back in her home country when she would go back and visit, but she was so generous with her time. She took us on a tour. We sat down. She answered all of our questions. And I mean, I think she wouldn't have gotten there without you and your team supporting her and guiding her and creating legislation to be able to make this happen. And it was a really powerful day. And just truly appreciate you taking the time and setting up those meetings, and being able to connect with your close collaborators, the Washington Medical Commission.
Yeah. Thank you so much, Paige, for coming. And next time, like, I wanted to keep the distance short, but next time when you come, I'll take you to Eastern Washington as well.
That sounds great. I can't wait.
And you can meet our other doctors. I mean, like, the program is growing. We have a neurosurgeon right now in, working with the license. We have, some specialists. We have, some other doctors. We have some family. We have OB. It is like, it's growing like wildfire. And I'm just happy, like, all the patients and benefiting from, the services IMGs are, because otherwise these doctors were like sitting at home mostly, waiting 10 years.
It is hard to believe that all these doctors and physicians and very, highly trained, highly skilled professionals are, just on the sidelines when we have rural community clinics who need physicians, other, more diverse communities that have a hard time finding healthcare professionals. We have such a shortage in this country. And so I really appreciate the advocacy that you and your team have worked on over the past decade, and also just really admire all of the resiliency and commitment from IMGs who come to this country and want to serve in different healthcare capacities and be able to treat patients. And that's really inspiring.
And the work that you guys do in creating these programs to make it possible, because, I always say, look, laws can be changed, but, the real work is on the groundwork, like what community, based organizations are doing to really help, individuals and participants, get off the ground and implement these programs. That's more important than anything. The laws give you like the ability to do that, but the hard work is like, the on the ground work, like those great organizations at the Rise are doing.
Yeah, totally agree.
Awesome. Yep. Paige, any last words before we sign off, or any advice that you would give to organizations out there that maybe want to do something in the future?
Yeah, I mean, we have a couple reports that have come out of Rise, but a lot of learnings and key takeaways. But I think, a few things that come to mind for me is we talked a lot about, especially in rural communities, the importance of building trust and moving at the speed of relationships and building social capital, and how critical that is for immigrant and refugees. And that really takes a lot of time. And that requires a lot of patience. And it also, a lot of funding is short term. It is kind of sprint nature, want to see implementation and outcomes done very quickly. But that's a reality on the ground, regardless of where you are. So I think that's just something to kind of hold and remember, is moving at the speed of relationships and trust. And a large part of what we did at Rise, which what we're doing now too, is emphasizing storytelling and narrative change. And for folks who are not in this space, who don't know about IMGs, who don't know about the barriers that immigrants, refugees, and asylees face in finding quality jobs or equitable education opportunities, there's a lot that we can do creatively with digital media. And it's been, harder now in this hostile climate where a lot of organizations are kind of pulling back and don't want to amplify their work as much. But there's a lot of really excellent storytelling that we did at Rise in the first part of our work. So we'll just encourage organizational leaders to think about how they can do that, effectively and safely, knowing there's a lot of sensitive information with their participants. And then I think engaging with policymakers, local policymakers, state policymakers to amplify impact is really critical. A lot of our Rise Network organizations, that's been a request for them to understand strategies and best practices, which you've been able to share your lessons and learnings, which we appreciate. And so I think that's really, regardless of program, or if you're in a more urban area or more rural, that's something that that would benefit all organizations. So those are just a couple, and diversify your revenue. That's what I would share. But everyone, all the Rise Network organizations are doing incredible work. We are so proud to be partners and collaborators.
Yep, 100% agree. Paige Korbakis, everybody, Director of Solutions Design and Delivery at Jobs for the Future. Thank you so much for joining us again, and hope you come back to the show.
Yeah, anytime. Great to see you.
All right. Thank you, everybody. And please don't forget to subscribe to our YouTube channel and follow us on all the social medias at TIMGA. And we'll be back with next week for another episode. Take care, everyone.
Bye.